Chloe. Today we're going to be doing a physical assessment on you. Can I get your name and date of birth?
Megan Morrow, 3/1/1994.
Perfect. And do you have any allergies?
No.
All right. And can you tell me what day of the week it is?
Monday.
Perfect. And who's the president?
Trump.
And where are you?
Clarksville, Tennessee.
Good. And she is calm, cooperative. Her skin tone is normal for her race. Skin turgor is good. Cap refill is less than 3 seconds. And I'm going to start by taking your blood pressure. Alright, and your blood pressure is 110/70. I'm going to check your radial pulse. +68 and +3, and I would do that bilaterally. I'm going to check your brachial pulse. And it is also +3, and I would do that bilaterally. Next, we are going to move to your head. Just from looking at her, hair's evenly distributed. There's no alopecia. Have you had any pain or tenderness with your head?
No.
Any problems with hair falling out that you've noticed more than normal?
No.
Okay. Alright. So the head is more monocephalic. It's midline. There's no lumps, bumps, knots. Gonna check the scalp. No mites, no flaking of the skin. Everything looks good with her head. Alright. And next I'm just going to feel your temporal, and it is palpable and soft. Do that bilaterally. I'm going to feel your sinuses, the frontal sinus. Is there any pressure or pain through here?
No.
Maxillary, is there any pressure or pain through here?
No.
Perfect. And we are going to move on to the eyes. So her eyes are symmetric, they're equal. Sclera is white, no redness or yellow noting. Conjunctiva is pink and moist. Can you close your eyes for me? Her eyelids are intact. There's no lumps, bumps, mites, or lesions. Her eyelashes fan out in a normal pattern, and there are none missing. Can you look at me, please? All right, and her pupils are equal, round, symmetric, a size 3. Okay, I'm gonna shine this light into your eyes. Swing in. Perfect. Okay, I'm gonna have you look at the tip of my pen, and then look at the corner of the window. Back. Perfect. And now I'm going to have you follow just the tip of my pen with your eyes without moving your head. Perfect. Cranial nerves 3, 4, and 6 are intact. We're going to move to the ears. Her ears are movable. Do you have any pain in your ears?
No.
No, they're normal size. They're even on both sides. There's no lumps, bumps, no excessive drainage noted, no foul odors. Next, we're going to do a whisper test. I'm going to have you cover one ear and I'm going to whisper something and you tell me what I say, okay? Popcorn.
Popcorn.
And now the other one?
Ice cream.
Alright, perfect. And cranial nerve 8 is intact. Moving down to her nose. Her nose is midline. There's no deviated septum. You've never had any type of surgery on your nose or anything like that, have you? No. I'm gonna look inside. Mucosa's pink and moist. I don't see any lesions, any bleeding or drainage. Can you close off one side and the other? Perfect. Her nose is patent. Next, I'm going to ask you to close your eyes. I'm going to place something under your nose and you tell me what you smell.
Permanent marker.
Perfect. Cranial nerve 1 is intact. Alright, moving down to the mouth. Can you smile for me? Cranial nerve 7 is intact. Stick out your tongue. Move it side to side. Cranial nerve 12 is intact. I'm going to ask you, have you had any teeth removed?
No.
Have you had your tonsils removed?
Yes.
Alright, perfect. Open your mouth. Alright. Hard palate and soft palate are intact. Mucosa's pink and moist. There are no oral lesions, lumps, bumps, no bleeding. No tonsils noted. She does not have tonsils. Can I see your teeth? Teeth are white, intact. They don't look broken, cracked, chipped. Everything in the mouth looks great. Moving on to the neck. No jugular vein distension noted. Her neck is midline. The trachea is midline. Can you swallow for me? Gag reflex is intact. Cranial nerves 9 and 10 are intact. Just going to get you to go side to side all around with your neck. Is there any pain? Do it one more time. And no crepitus noted, so full range of motion of her neck. We're going to move down to the arms. Can you shrug your shoulders for me? Great. No crepitus noted there. Good strength in those. Can you put your arms out for me? They're equal in length. They're the same size. One's not larger than the other. Don't let me push up. Don't let me push down. Perfect. We're going to rate her strength as a 5. She's got good strength bilaterally in her arms. Range of motion of the elbow. Does this hurt?
No.
No crepitus noted. Wrist. Can you roll it around for me? Range of motion of the wrist is good. No crepitus noted there either. I would do that bilaterally. And then we are going to look at her chest. No barrel chest noted. Her chest is even. Her effort of breathing is good. The rise and fall is even. Have you had any difficulties breathing?
No.
No. We're going to listen to your heart sounds. Alright. The second intercostal space on the right sternal border is going to be the aortic. Second intercostal space left sternal border is pulmonic. Third is Erb's point. Fourth is tricuspid. And the fifth intercostal space at the mid-clavicular line is the mitral, where we're going to listen to the aortic, or the apical pulse for a full minute. Alright, 72. The apical pulse is strong, regular, no murmurs or abnormalities are noted there. Next, I'm going to listen to your lungs. Just take some deep breaths for me. 1, 2, 2, 3, 4, 5, and 5. Did you stand up for me? 1, 2, 2, 3, 4, 5, 6, 7, 8, 9, and 9. Perfect. No adventitious lung sounds noted. You can have a seat for me. No adventitious lung sounds noted. Everything sounds good. I'm going to go ahead and check your carotid pulse. And I would do this bilaterally, one side at a time. It's a +3. Feels great. All right. And moving down to your legs. Can I get you to stand up one more time for me, please? Perfect. Her legs are equal in length. They're the same size as one another. One's not larger than the other. Alright. Just going to do some range of motion. I'm going to have you pull your knee up and go back and forth with it. Perfect. Full range of motion of that knee. No crepitus noted. I would do this bilaterally. And with your hip, come up and out. Full range of motion of the hip. No crepitus noted. I would do that bilaterally. Can I have a seat for me, please? And move your ankle around. Full range of motion of the ankle. No crepitus noted. I would do this bilaterally. There's no edema or swelling. Color is normal for her race. Would do this bilaterally. Then I'm going to check the dorsal pedis pulse. It is a +2, and I would do that bilaterally. The tibial pulse. Tibial pedis pulse. And it is also a +2, and I would do that bilaterally. Down here. Are you diabetic?
No.
No. Have you noticed any type of foot pain or anything like that? No? Alright, I'm going to be checking the feet, inspecting to make sure there are no lesions. There are no lesions noted. Checking in between the toes. Cap refill is less than 3 seconds. Everything looks good with her feet. No lesions, no lumps, bumps, nothing of that sort. Feet look great. Alright, can I get you to lay down for me, please? Perfect. And can you tell me when your last bowel movement was?
Yesterday.
Alright. And do you have any trouble using the bathroom or anything like that? No? And was it hard, soft? Was it difficult using the bathroom? No? And when you pee, do you have any trouble peeing? Does it burn? Do you notice any foul odor?
No.
Notice any discoloration or blood in the urine?
No.
Do you pee more during the day or more at night?
During
All right. And we're going to find the belly button. Umbilicus here. We're going to start in the right lower quadrant. Right upper quadrant.
What are you doing?
Left upper quadrant.
Okay.
Left lower quadrant. Perfect. And her bowel sounds are normoactive. And to say that her bowel sounds were absent, you would have to listen in each quadrant for 5 minutes each one. Her abdomen is flat. It is soft. It's not distended. Do you have any abdominal pain?
No.
No pain noted. All right, and next I would wash my hands and clean up my supplies, and this concludes our head to toe assessment.